Hello everyone, my name is Andrea. I am a med-surg registered nurse and I am in the process to transition to become a case manager. I am not an expert in the field, this is my first time. So I wanted to create this presentation to provide information, some basic information on the role of the case manager and to give you guys an idea and what leadership skills are necessary to be a successful case manager. So in order to create this presentation, I did a lot of research regarding case management and even talked to different case managers that have a lot of experience in the field about their job and what skills they consider vital and have been helpful for them in their careers. Now, this presentation will focus more on the registered nurse case management, but for your information, there are around different types of case management, and that is the registered nurse case management, but we also have the social worker case management and also the case coordinators. So the goal or the objective of this presentation is to provide basic information for nurses interested in case management. I'm going to give you some information about the role of the case manager, how case management can help the client, and also I want to show you how it has been proven that case management increases patients' outcome and reduces cost. I also want to provide you some information about case management, where a case manager can work in the many different organizations. And I want to talk to you a little bit about some leadership skills that every case manager needs to have in order to be successful. We also will talk a little bit about the different case management models, and we are going to discuss what tools are available to case managers that can be used to help the client. So, like everybody knows, the healthcare system can be a complex system to navigate. And for many individuals, even for healthcare professionals, that is the case. It can be daunting to know all the components that are involved in the care of a patient. Now, so for the patient, the task of coordinating their care, or for some patients, it can be even more complicated and overwhelming. Patients face the challenge of deteriorating health. They need to understand insurance policies and coverages. They need to figure out when to see a specialist with the help of the doctor and coordinating the visits. Additionally, they also might not have the needed support at home to stay safe and get better. Frequently, patients cannot afford to pay for the needed care or medications. So all that, it adds a lot of stress and confusion to a already complicated situation. Now, because of this challenging task, it is not a surprise to see how a case manager is such a vital member of the healthcare community. A case manager coordinates the long-term and also sometimes short-term care component for the patient. And they do that a lot of time by collaborating with other healthcare professionals to coordinate appropriate care for the patient. Also, case managers, they help the client allocate available resources and work with the client to reinforce the treatment goals. You can say also that a case manager oversees the process of care delivered to the patients. It works with collaboratively and provides leadership to the healthcare team and is committed to the organization goals, whatever those goals are. So now that we define the case manager role, I want to dive deep in what it is that case managers do. So we mentioned that a case manager main goal is to meet the patient's comprehensive health needs. And that means coordinating with the interdisciplinary team to the care of the patient, allocating resources, and advocating for the patient. In order to accomplish that, the first thing case managers will do will be a comprehensive assessment that will include the patient physical and emotional needs, and together with the patient they will establish some goals. So some of the tasks that a case manager will do to reach those goals are, but not limited to, communicating with the interdisciplinary team to coordinate the patient's care, and that might be also include setting up appointments with a specialist on behalf of the patient, monitor treatments, assess the effectiveness of those treatments, and work with the insurance company to know how to help the patient receive the most cost-effective care. Case managers also provide patient education and discharge planning to make sure the patient is going home to a safe environment. Also, the case managers helps with patient transitioning from a place to another. So let's say that the patient is going from a hospital to a rehabilitation facility to receive some type of treatment. So the case manager will work with the patient in that facility, in the hospital, to make sure the patient is transitioning or transferring safely. Another thing that case managers do, they also help clients connect with resources and help them identify what works for them. So by allocating resources within the community, the case manager can help the patient, either by finding resources about medication help or food assistance. And that is just a very small list of how a case manager can coordinate patients' care. So according to the facility you will work for, they will have a variety of patients that have certain needs. So maybe let's say that you will be working in a mental health facility and you will need to help probably a group of people, patients that require some mental health assistance. So as a case manager, you will need to be aware of not only your client physical needs, but also the emotional needs, any therapy that they might need. And you will talk to the people that are working with this patient and see what are they doing to help the patient, and together you're going to come up with a plan that will address this patient needs. So basically, as a case manager, you become the single point of contact to make sure that there is non-fragmentational of services. Because normally, with the patients that case managers work with, they require the need of different specialists or people that are helping the patient. And you can see how it can be confusing and very ineffective if everyone is doing their own thing and not communicating with each other. So the case manager becomes a main point of contact to make sure that everybody is on the same page regarding the care of the patient. So case managers, they are basically a vital member of the healthcare system. And their job, started a while ago because organizations, they were seeing a high volume of patients that were being readmitted to the hospital because of poor care management. For example, they were seeing patients with heart disease and diabetes uh, being discharged home with, the discharge instructions, and then maybe the instructions will include something about taking a blood pressure medication, insulin, and the patient will go home and not follow the instructions, either because the patient didn't have the means to buy the medication or didn't understand the treatment or the instructions, didn't follow up with the provider, didn't know how to set up an appointment with a specialist if that was the case. So the patient in a few weeks will end up again at the hospital with the same problem. So after looking at all these cases happening in many healthcare institutions, they realized that they could help these patients get better and decrease the readmission rates and even lower their costs by having a person there that could manage and coordinate the patient's care. And that is just like a small example how case managers are a vital member of the healthcare system. Now, today, case managers, they do a lot more for the patients, and it has become a more important job after the healthcare reform and all the issues that we have with insurance, especially Medicare and Medicaid, different reimbursement strategies. So case manager has a great impact not only on the patient's outcome, but it also has helped many organizations decrease their costs while at the same time maintaining quality care. Now there are a lot of many studies, case studies out there that proves how case manager has decreased cost and increased patient outcome. I am not going to give you that information right now for the sake of time, but I will be posting information in the reference page that you can review and take a look at that information if you are interested. So where can a case manager work? Case managers, they can work in a variety of places where there is a need to help the complex uh, care patient coordinate care. Case managers can work in hospitals, long-term care facilities, hospices, outpatient and outreach clinics, mental health centers, and even with insurance companies. Also, the case manager can work with government sponsored programs, life care planning, and even in disease management. So the case manager, they can work with a variety of clients, not only the multiple health, the client with multiple health problems, but also with patients with special needs, such as minority clients, clients with HIV, mental illness, the homeless client, or individuals with substance abuse problems. So if you are a nurse that are if you're looking into case management, you want to decide what population you want to work for or with, uh, and then trying to get some experience working in an organization that help that type of population. Okay, so now I want to talk to you a little bit about the different case management models available. And the type of case management model that you will be using, it will depend on the organization that you're working for and the clients that you will be seeing. Also, the information that I'm going to be giving you is very basic. There is a lot more information out there about case management models, and the organization that you will be working with or you are working right now should be able to provide some type of training and information about which case management model they would like you to use. Now, for the purpose of this presentation, I will talk about four common case management model that is we can use as case managers. So the first one is the brokerage generalist model. In this model, the case manager will assess the patient's needs and help the patient find resources. For example, let's say that the patient is in need of medical services, maybe a little bit of help with prescription drugs and maybe food assistance. The case manager will allocate the resources and talk to the patient about the available resources and how they can be acquired. Then after that, the case manager will probably follow up with the client to make sure the client was able to acquire what they needed. This type of case management is very straightforward. The second one, the strengths-based case management, this type of case management do more outreach and assess the individual strengths and focus in those strengths to help the individual meet the goals. This type of case management model can help clients that suffer from mental illnesses and need to move from an institution to their own home. And that's just an example. So by identifying the individual strengths, the case manager teach and guide the client to set up goals and how to achieve those goals step by step. The third one, the clinical case management, it is a more comprehensive case management model, and it includes all the patient's life area. The case manager works very closely with the client to help him or her meet the goals. And this model focuses a lot in family and individual self-help through therapeutic activities and also by receiving therapy. This case management method is very effective for clients that need continuity of care. And the last one, the intensive case management, it is used for less or for acute patients that need intensive support for a short period of time. In this model, the case management completes a comprehensive assessment and work with the providers and community health workers, dietitians, and other agencies to help members access the care and programs that they need to achieve their health goals. The case manager will reinforce the provider's plan of care and provide teach-back learning and education to improve self-reliance. So as you can see, the type of case management model that you'll be using, it will depend on the institution and the type of client that you are working with as well. So as you can see so far, case managers are leaders in the healthcare system. And they do a very good job coordinating the patient's care. So, in order for case managers to effectively do their job, they need to have some leadership skills. Case managers need to be effective communicators. They need to be confident and transparent, and they need to be innovators and constantly find solutions to problems. They also need to have a passion to help others. And what I want to do, I want to talk about each of those skills in more depth. So an extremely vital skill for case managers is effective communication. Case managers, in order for them to do their job effectively, they need to have excellent communication skills, people skills, interpersonal skills, and they need to be able to engage with a team. Communication is a vital leadership skills for case managers, and leaders that are great communicators, they're able to engage and inspire the care team in ways that can boost performance. It can also foster collaboration and improve the patient's outcomes. So case managers are constantly communicating with the members of the care team, communicating with agencies, trying to allocate resources for the client. They're frequently talking and assessing the client and family. So you can see how vital it is to be able to effectively communicate for case managers. So what I wanted to do, I wanted to provide you with some tools that can be used to gather information and help you coordinate the patient's care. So I did some research about what communication techniques can case managers use or for them to become a more skillful communicator. And what I was able to find, I was able to find various techniques that you can incorporate in your daily communications. I will be quoting some information and give credits to the amazing people that provides me with or provide us with this very useful information. So the first communication technique I want to mention is called OARS, O-A-R-S. Now, OARS stands for open-ended communication, affirming, reflective listening, and summarizing. OARS is a skill-based, client-centered model that will help case managers establish and maintain rapport with their client, assess your client's needs, and personalize your counseling and any education that you need to give this client. Now, if you remember how vital it is for case managers to comprehensively assess their clients and learn about the client's needs as much as possible, you will see how this technique can be a great tool for case managers. The first step is to gain information about the client by asking open-ended questions. When you use open-ended questions, you are able to establish a safe environment and help to build rapport in a trusting and respectful professional relationship. You can also explore, clarify, and gain any understanding of your client's world. You can also learn more about your client's experiences, thoughts, feelings, and any hopes for the future. The second step, affirming, in this step you need to show empathy. So case managers, they need to be able to empathize with their clients and affirm their strengths and accomplishments. You need to be able to build up your client's strengths and share a belief that they can be responsible for their own decisions and life choices. So in this step, you will be using phrases such as, it sounds like you've been really thoughtful about your decision, or it seems like you are really good at this. The next step, reflective listening. You are going to listen to your client to gain a deeper understanding of their situation. And while you do that, you can reflect in what they are really saying and ask for confirmation. And the last one, the last step, summarizing. In this step, you will be making sure you understand your client's goals and you will confirm that your client has an understanding of the plan or the goals. In this step, you will use phrases such as, let's go over what we talk, or in closing, you can say, let's review the plan. So you can see how by following these steps, you will be able to gain a deeper understanding of your client's situation and be able to come up with better solutions or appropriate solutions for any problems that they might have. I want to talk a little bit more about active listening. So when you are actively listening your clients, what they are saying, or any other individual for that matter, you are not only listening to what they're saying, but also gives you the opportunity to assess the patient and look for those nonverbal cues that can provide more information about this person when you are communicating. And skillful communicators, they're not just only listening, but they're also seeking and reading between the lines. They want to really know what is this patient really saying. They're paying a great attention to the subtle nuances of the conversation, the tones, and any nonverbal indicators. And the next communication technique I also want to talk to you a little bit more is about requesting feedback. So when you request feedback or requesting feedback is a powerful tool because it guarantees that the message was received and it helps clarify any misunderstandings. And just a simple act of confirming the mutual understanding of the message is a very powerful tool for case managers. It basically, you want to make sure that your patient understood what you said uh, and vice versa. And you want to make sure that both the case manager and the patient, they understand the goals and what are the steps that you need to follow in order to achieve those goals. The next communication technique is that you can use when you are communicating is that you need to try to forget about yourself. We see this very often. People have a natural tendency to talk about themselves and forget about what other people has to say. Now remember that as a case manager, you are trying to get the full picture. You want as much information as possible, and for that, you need to forget about your ego. Don't try to dominate the conversation. Instead, encourage others to talk more about themselves. You need to show genuinely interest about what the other person is telling you. And this can be a great opportunity to incorporate some open-ended questions. And by doing so, you will create um, or you will be able to place that other person at ease and easy connect with them and gain their trust. The next communication technique is you need to use the compelling power of humor. So according to Mueller, in his article, 19 Brilliantly Effective Communication Techniques, humor, when used correctly, that's important, when it is used correctly, can be an effective tool in your communication arsenal. It can help you to quickly get your point across, uh, and also it can be a more powerful when it comes to lightening the mood. And sometimes you need to do that, especially in some conversations that can be kind of serious. Like I said again, it depends on the situation. So when it is appropriate, the use of humor can be a great tool when communicating with other individuals. And the next technique I want to teach you, it's about avoiding information overload. Especially in healthcare, there is a lot of information that can easily overwhelm the patient. It can easily overwhelm your client or any individual that is not familiar with what we do. So you want to avoid medical jargons, of course. You need to keep your communication simple, clear, and to the point. Effective communicators make sure that they do not stimulate their peers with too much information. Instead, they focus on exchanging information in a concise manner and keep it to the point. Additionally, by using questions, they keep their listeners engaged and attentive. And also remember to ask for feedback to make sure the listener understood the message always. A last communication tool that can be used, especially during a conflict, is called the triangle talk model by Kerr Anderson. And this model can be used when there is a conflict and negotiation is needed. Now, case managers, they will encounter a situation when there will be some type of conflict. And for example, either the patient is not interested in following the prescribed treatment, or a member of the team doesn't agree with the proposed treatment. So whatever it is the situation, the case manager needs to be prepared to deal with the conflict. And when it comes, this triangle talk model can be useful to be able to help the case manager navigate that situation. So there are 3 steps. The first step, in the first step, the case manager needs to know what she or he wants or the patient wants. And the second one, you need to find out as a case manager what this other person want, the person that you are having a conflict with, and assure them that you listened and heard their concerns or requests. And the last step, it would be to propose an action in a way and language that they can be understood by the other person. So let's review each of these steps. In the first step, so often people, they are not clear in what they want. For example, the patient might talk to you about getting better or wanting to get better, but is not willing to carry out their treatment plan. Or the client might talk about losing weight to help with their blood pressure issues, but then complains about the exercise regimen that is required. So the case manager needs to be clear in what the the patient really wants. They need to be precise, and if it's possible, need to make sure the goals are measurable. The second step of the model is to find out what the other person wants. So if I am the one having a conflict, let's say with a member of the team, I need to find out what that other person, that team member wants. And I need to make sure that I assure that team member that we listen to his or her concern. And this is the most difficult step on the process because there is a lot of emotions involved. So as a case manager, I need to practice active listening, and I need to be able to use the right words to make sure that the other person understands that I am listening to their concerns, and that I am just not necessarily agreeing to their point of view, um, but also empathizing with them. Now, the third step is when you provide solutions in a way that the other person can understand. And now that I know what the other person wants, I'm more prepared to offer a solution that meets both parties' requests. So maybe both individuals will need to compromise in order to get what they really want. Others have described this as a win-win negotiation where both parties work together to achieve both sets of desired outcomes from a negotiation. So by using this technique, it can help you to navigate any difficult situation when you need to work together with somebody else to be able to accomplish uh, a goal and basically get something done sometimes. So stepping outside from the communication skills that case managers need to have, I also want to talk to you about other leadership skills that our case managers uh, can use, and it can be of help to case managers. So let's talk a little bit more about confidence. So it's been said that confidence is the cornerstone of great leadership. Having the self-confidence to make key decisions, confront new challenges, and persevere through failures is critical to inspiring confidence and resilience in employees. And that was told by Marshall in one of his articles. Now go ahead and place all this information at the bottom of this presentation. Case managers are continuously making decisions and leading others within a team, and for that they need to be confident. You cannot be indecisive or insecure because you need to lead others. And that being said, it doesn't mean you need to know everything, but you need to be confident in what you know. Another skill that it can be very useful for a case manager is transparency. So a case manager that is transparent in his dealings with the patient and the team basically inspires trust. Patients need to know that their case manager has his or her best interest always. And for that reason, trust must exist between a patient and a case manager, And transparency also can aid to uh, accomplish that more effectively. As a case manager, you will also be working in different cases at the same time. You will have probably a large caseload. Um, Depending on the organization you work for, you may find yourself working with many individuals at the same time, or many clients at the same time. You'll be doing a lot of paperwork, making a lot of phone calls, answering a lot of emails. So you can see how it is important for the case manager to stay organized, to be able to manage all these cases without being overwhelmed or confused. Now, generally, nurses, they're very good at staying organized because it's something that we need to do on our daily jobs, right? And we need to do that in order to survive in our work environments. However, if you struggle staying organized, you will need to come up with a plan or ways that will help you, and for that, there is a lot of ideas and resources online that you can utilize and try to see what works for you. I'm not going to provide any ideas in this presentation right now, but uh, just to let you know, there is a lot of help out there and ideas that can be easily accessible. Another skill that you need to have to be a more effective case manager is critical thinking skills, because you will need to make decisions, good decisions, critical thinking decisions for your patients or your client. For nurses, they know how vital critical thinking can be, and that is not an exception for case managers. This is especially true with patients that are critically ill and need promptly assistance, or for the patient that requires transitional care. In these situations, case managers need to use their critical thinking skills to assess the situation and provide appropriate solutions. So many of the patients you will be helping as a case manager can have many problems, and they will need a case manager that is an expert in allocating resources for their patients. So as a case manager, you need to be an expert. You need to know what resources are available in your community. Um, Now, sometimes the solution to an existing problem is not available, and case managers must make use of innovative ideas and in collaboration with the healthcare team to overcome obstacles. It can be difficult and frustrating for case managers to not have the resources available uh, to be able to help the client. But this is why being innovative and figure out alternative solutions is very beneficial for us or for case managers. And lastly, case managers, they need to have a passion for helping others. It will be difficult. It will be very difficult for a case manager to stay at his or her job if they don't really have a passion to help other people, because that is your job. That's what you do. You're a problem solver. You help people solve problems. And in order to do that, you really need to love to help people. Otherwise, it will be very difficult for you to stay and do your job effectively. Okay, guys, so just to wrap it up, the information in this presentation is very basic. There is a lot to being a case manager, and there is a lot more that you will need to learn. However, there is a lot of information out there. There is a lot of organizations that provides training, programs, conferences, and certification that can be very beneficial for case managers. There's a few that I would like to mention that you can research and see if they have something that you'll be interested to. Um, and the first one is the American Case Manager Association, also called ACMA. So this organization or this association, they provide case managers with online case manager training, conferences, updates. Um, they also help you prepare for the case management certifications whenever you are ready for that. There is also the Case Management Society of America. This organization also provides case managers with education, and they have a large library classes that you can find a lot of information there. And they also help you with certification if you need that as well. There is also the National Association of Case Management that provides webinars and conferences and updated information. And the last one that I want to talk to you about is the Commission of Case Manager Certification. And that one is basically the gold standard for case managers. Their website will help you to prepare for the CCMC certification. But if you are not there, this website also provides a wealth of information for case managers at any level. They have continuous education courses, they have recorded webinars, they even have podcasts that you can listen on the go. It is a good place to start gaining information about case managers. So, as mentioned before, there is a lot of knowledge online. There's a lot of resources out there for future case managers and nurses that are already working as case managers. So you just need to take your time and do some research, and you will find a lot of information out there. So I hope this presentation was helpful in some ways, or maybe you gain some knowledge about case management or a communication technique that can be useful for basically anybody in healthcare. If you have any information, any useful information about case management, please comment in the box below. Also, take a look at my references. I just want to make sure that I've credited the people that were able to provide the information that I used to create this presentation. Thank you, and thank you for your time.